So let's start with GB30. This point is located with the patient lying on their side. The point is at the junction between the medial 2/3 and the lateral third of a line connecting the trochanter and the sacral, the greater trochanter and the sacral hiatus. This point is called the point for the longest needle. As we can observe, it is located in the buttocks, so this point is quite deep. That's why needling this point may be around 2 to 3 chun perpendicular. It is a useful point to treat hip and back pain, and there is a very good reaction with hot needles on this point. Next point is GB31. On the lateral aspect of the thigh, inferior to the greater trochanter, approximately 7 chun proximal to the popliteal crease. This point is the wind eliminating point for hip and leg. This is a good point against itching, allergic reactions, and pains moving up and down the leg and hip. This should also be used with the wind elimination technique. Next point is GB34. It is located in the depression anterior and inferior to the head of the fibula. This is the influential point for muscle and tendon. It is used in all problems of the locomotive system and in paralysis, tension, etc. Next point is GB36. It is 7 chun proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula. This is the xi-cleft point of the gallbladder meridian. It is an effective point for quickly relieving gallbladder pains or migraine headaches. Next point is GB37. It is 5 chun proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula between the peroneus longus and extensor digitorum longus muscles. This is the luo-connecting point of the meridian. It is used to tonify the yang and reduce the yin at the same time. It is a very effective point in the treatment of long-sightedness with special difficulties with night vision. It is also a good point to promote elimination of bile and remove stagnation in the gallbladder. This point improves the free flow of thick fluids in general, and because it is the young coupled organ of the liver, it promotes free flow of blood in the blood vessels. It is an anti-cholesterol point. Next point is GB38. It is located 4 chun proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula. It is the sedation point and the fire point of the gallbladder meridian. It is 1/4 the distance between the popliteal fold and the prominence of the lateral malleolus, which is a 16 chun line. This point should be located using proportionate measurements in order to be accurate.